It's Mike Stark, Stark Reports, with Congressman Jason Chaffetz from Utah, correct?
Yes, yes.
So yesterday there was a big healthcare thing. And,
Now I don't see the light on. Is it on?
Yes, it's on.
Oh,
It's
okay.
on. And, very good. And what I wanted to ask you about specifically is during the conversation around the table, Louise Slaughter brought up a anecdote about a woman that had lost her teeth. She had no teeth. She was older. And her sister had died. So what she did was she took the dentures from her sister's mouth and used them for herself after her sister had passed because she couldn't afford dentures herself. And listen to this.
Slaughter comment on the dentures. I'm getting so many people. This is big. I mean, that gets a one-time mention for a laugh. But there are people out there that think this is huge because it's so stupid. I mean, for example, well, what's wrong with using a dead person's teeth? Aren't the Democrats big into recycling? Save the planet. And so what? So if you don't have any teeth, so what? What's applesauce for? Isn't that why they make applesauce?
So the idea here is that this is the populist rhetoric from the right wing. I mean, it's the Beck, it's the Limbaughs, it's everyone else. And it's not leaving you guys a lot of room to compromise. When every Republican that's, slaps down this, I assume you don't agree with Rush Limbaugh on this.
Well, I didn't hear what she said, but I mean, yeah, we've got to be compassionate here for people. So,
Right.
Don't take it lightly when somebody has to
But
deal with something like that.
That's what your peeps are hearing back at home every single day. These are the leaders of the conservative movement, the populist conservative movement for the most part. And every Republican that's ever, from Michael Steele to Phil Gingrey, your colleague, anyone that's ever said anything deleterious about Rush Limbaugh or Glenn Beck, Rush Limbaugh, I should say, they've had to call up within a day or two to apologize and say, hey, listen, I really didn't mean to tell you not to do what you're doing. But some of this stuff is really, not compassionate is putting it mildly. How much room do you folks have to compromise when the leaders of the conservative movement are out there feeding all this stuff to the people back at home?
Well, we can be compassionate. We got to work with people and reach across the aisle. I think we can absolutely do that. I don't take marching orders from Rush Limbaugh. He's entitled to his own opinion. He says a lot of things I agree with. He says some things I don't agree with. So, I got to vote my own conscience and listen and respond to my constituents in Utah. That's my role and responsibility.
Do you see any circumstances under which you could vote to pass health care reform?
The current bill? Absolutely not. Do I want to have reform and health care and work with it? Of course, absolutely. But the current bill? No.
We've heard a lot of Republicans say that they would like to get some health care reform passed.
Sure.
When y'all controlled Congress, why didn't you do it then?
Well, I wasn't here. I'm just a freshman. I didn't create this mess, but I'm here to help clean it up. I mean, I came here because I felt like in many ways the Republicans had the House, the Senate, and the presidency, and they blew it. And I saw, I unseated a 12-year incumbent Republican because I felt like they did some things that I didn't agree with. For instance, the prescription drug benefit, one of the biggest unfunded mandates to come out of Washington, D.C. in a long time. I thought that was wrong. So,
yeah, I thought it was kind of funny how we talked about cost yesterday when we all knew in the back of our minds that cost wasn't even a consideration for Medicare Part D.
And I disagree with that.
Has leadership been receptive to freshman Republican ideas for health care reform?
Yeah.
I'm wondering if you've had a lot of input yourself. What are some of your initiatives that you'd like to see? What's important to you?
Right at the top of my list is I think we ought to drive these types of decisions back down to the states. The states are the laboratories, and they have the most responsibility. They're
all broke right now, though, right?
Well, some are more broke than others,
right.
And no doubt it's difficult. I'd like to see those dollars flow through to the states. They're closer to the problem. They're closer to the situation. I think they'll be more responsive to the public's needs. And look, the needs in Utah are going to be dramatically different than they are in New York or Florida or anywhere else, and vice versa. So I think if we could make those decisions at the most local of levels, and there'll be some federal involvement that allow products to be sold across state lines, tort reform, those types of things. I'd love to get involved in. So.
Congressman Chaffetz, I think this is your first conversation with Stark Reports. Thanks very much.
Thank you.
Take care.
Okay.